This portion of New Day Northwest is sponsored by the Polyclinic.
Welcome back to New Day and Wellness Wednesday. Finding one good doctor you can rely on is a key step to personal health care. But when you have a group of doctors who coordinate with one another as a team, it's the patient who definitely comes out on top. Please welcome from the Polyclinic rheumatologist, Dr. Jennifer Gorman, and orthopedic surgeon, Dr. Christopher Cannon. Welcome to both of you. Thanks for being here. Jennifer, Dr. Gorman, Dr. Jennifer, I think I'll call you. We're going to meet with one of your patients in just a minute, but tell me a bit about this well-coordinated, integrated care approach and why this is so beneficial for outcomes.
Well, I think at the Polyclinic, the patient comes first. So it's all about the patient, and the rest of us are working together to get the best outcome. Mm-hmm. We're physician-owned, which we have more ownership, more stake. We don't feel like salaried physicians. We feel like we're the ones that are making the decisions and doing what's right for the patient.
So it's a bit of one-stop shopping, right? Because if you need to coordinate with some other doctor, they're there. We don't have to send the records, start over again, that kind of thing.
No, 30 different specialties. We have our computer systems shared with others so we can see when things are done at other places so they don't have to be duplicated, so it's comprehensive.
I like that idea. Now we're going to talk to your patient Andre in a bit, and you helped manage some severe arthritis with him. Tell me a bit about his case.
So when I first met him, it was early February of this year, and I was actually seeing him for a different medical condition, but he's very precise and thoughtful, and what he was describing to me was very different than the reason he had been referred to us. Mm-hmm. And so we sort of delved into that area and realized his left hip was the major problem in his life, for quality of life. So we got an x-ray that day, and a week later got a steroid injection. He was already doing all the right things, physical therapy, and I think he wanted to give it a little more time to see, but the injection helped. And then 2 months later, we brought him over to Dr. Cannon, and the rest.
That's when things get serious because he's the surgeon. And Andre, we should say, is an Olympic rower. He's put some wear and tear and some miles on that body. Yes. But when you decided that maybe something more serious was needed, then it was easy because Chris was right there.
Exactly. And I think, Andre is so athletic. He's a perfect person. He shouldn't feel limited by the severity of his hip arthritis. He should get a new hip and continue with all the wonderful things that he's doing. And Chris is just right down the hall, and we work together on patients. And what I love about Chris is many surgeons will just do surgery because that's what you're asking them to do. But Chris often comes back to me and says, hey, can we try this? Can we give a little time? And so he's very thoughtful in his approach. So when he was like, yes, 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 for Andre, we knew.
Is it kind of nice just to be able to physically be together, yell down the hall, go look at records together as opposed to talking on the phone or Skyping, that kind of thing? Does it give you a little more deliberative time?
Absolutely. And as she said, they normally do a very good job of having people kind of teed up and ready for surgery to try the non-operative treatment of physical therapy and medication and injections. But if we think that hasn't been done or we think there's some other things we could try, it's very nice to be able to walk down the hall and actually be face-to-face.
To confab a little bit. I mean, we sort of lose that with all of the different ways to contact one another, but I like the idea that my doctors are, heads down over the records trying to figure it out. Andre Nowaczyk is our patient who we've been talking about today. What was your experience with the care you received?
The best experience one can have with Polyclinic people. Because my story started here when I was 13 years old.
This is a great photo of you rowing way back in the day, right?
Yes, but many years of abusing practically your body without knowing it, till the time came to decide what to do with all that pain and discomfort. That's where Dr. Gorman and Dr. Cannon came in. And from the meeting, for the first meeting, the rest was easy to make a decision and go for surgery and then recuperation. It's beyond expectations.
And so how's your health now?
Very well. I do practically anything. Maybe a little slower, but anything.
That sounds wonderful. And the scarf in your lap, is that from Tokyo, from the Olympics?
Yes, that's part of my Olympic experience. Tokyo 64, 50-some years ago. But the journey continues because what you learn in the early years, the discipline and devotion and commitment, very easy to find help later on in life when necessary.
I'm so glad you're doing well, and congratulations. Whenever you're in the Olympics, you get to say that for the rest of your life. So that's wonderful. What did you do for Andre?
We did a hip replacement, a total hip replacement. And as I mentioned, he really had not improved enough with the non-operative treatment that had been tried. And so, as seen on the little model here.
Okay, you have to explain this to me.
Yes, exactly. So there's not a normal hip to show, but your hip, of course, is a ball and socket joint. And his own ball, his femoral head, had worn out completely. And so we put in something that looks like that. And so there's a metal piece that fits down the femur. And
Yowza.
Exactly, and then a metal socket in there, and then it all fits back together. In recent years, we've moved to what they call an anterior approach.
What does that mean?
When you do the surgery, you have to approach the hip from one side or the other. And actually, there's several different approaches that can be done. Traditionally, in the United States, they have been done through what's called a posterior approach, which has worked fine for many years, and many people have done very, very well with that. But in recent years, there's been a move towards doing it from the front, and the big issue is it's kind of one of the minimally invasive procedures, so very soft tissue friendly. Right. There's no muscle cut. After surgery, there's no dislocation precautions, so you don't have to tell people, don't cross your legs, don't sit in a low chair. And so it makes for an easier and less painful recovery.
Right, and they can get back to normal life more quickly.
Exactly.
We're going to talk more about this in our wellness panel in a bit. How long does that thing last?
We think pushing 30 years, so a long time.
Okay, I'm kind of glad I'm aging in the age of new knees and new hips. I think that's wonderful. Thank you both very much. After the break, don't let a nasty flu bug sneak up on you. It's not too early for a flu shot. In fact, I'm getting mine right here in our next segment. We'll be right back.